Tom, I got to tell you, I wanted this decision, but I was completely surprised. Were you?
Well, not really. I think what we're seeing is a different context. You have most adults vaccinated. You have cases at 1/10 the rate they were at the peak. And you have more and more evidence that vaccines are highly effective at preventing infection and even more effective at preventing serious infection. So in the US, we can see light at the end of the tunnel. We can see the end of the pandemic coming. We're not there yet. We've still got a lot of cases, but I anticipate that in the coming months, cases will continue to go down. Then we'll be dealing with clusters and outbreaks. I think the challenge here is that we still have a lot of unvaccinated people, unvaccinated communities, and the variants are the big wild card.
Well, there are people worried that this could become a free-for-all. But given how conservative this CDC has been, to make a call like this, does it tell us that the pandemic isn't over, but it's certainly almost behind us?
We've certainly seen the worst days of the pandemic in this country. Stephanie, I want to get back to the global situation in a minute because that also affects us. There is some important fine print here. If you're immunocompromised, you want to be more careful. If you're concerned about influenza or other things in flu season, you may want to wear a mask at certain times. And if things change, if variants spread, if cases begin to go up again, we may see changes in recommendations. But right now, the challenge is to continue to roll out vaccination as rapidly as possible in this country while we address the global problem. Because globally, we're still in terrible shape. Vaccines are nowhere near available enough. We're not vaccinating healthcare workers globally, the elderly globally, and we don't have the kind of supply coming for at least a year unless we take a very different approach. So unless the pandemic is over globally, it won't be over here, not only because of travel, trade, stability, economy, but also because anywhere there's uncontrolled spread, there could be more dangerous variants emerging, and those variants could cause a real problem here or anywhere. So we are really all connected. This is good news. It's a remarkable tribute to the progress, both scientific progress, making great vaccines, and everyone's progress getting vaccinated.
Well, you've been saying for months we need to follow the science, not make this political. The CDC has spoken. If we see states, local governments still keep their mandate, not listen to the CDC, what does that say to the American people? Won't they get frustrated? Wasn't it? I thought we were supposed to listen to science.
It's a confusing time. So I think a mandate for out of doors doesn't make any sense. And I've said that for about a year. For indoor mandates, how are you going to know who's vaccinated and who's not? In some countries, they have proof of vaccination. If you're proven to be vaccinated, you can come in, have 100% occupancy at restaurants. But here we don't have any accepted way of doing that. In New York, there is the Excelsior Pass, but most states don't have that, and some have actually banned it. So what do you do about an indoor space? What do you do about gyms where aerobics instructors may be shouting, or choirs, which we know spread a lot of COVID? So I think there are some complicated areas. There's fine print here, but the big picture is things are getting better. They're going to continue to get better. And the more we vaccinate and the more we share vaccines and vaccine technology globally, the better off we'll be, the safer we'll be, and the sooner the world can put this pandemic behind us.
Before we go, we've spent a lot of time in the last month or so talking about vaccine hesitancy. And I want to play part of what a woman told us yesterday when she heard the news and how it relates to getting a vaccine.
I get vaccinated in a second. If it means I don't have to wear a mask anymore, done. I'm over it. So over it. I just want to work with no mask, show off my pretty smile, you know, and see other people's beautiful smiles.
Is this the motivator for people who are hesitant about getting the vaccine to finally get them over the hump and get the shot?
It's one of the motivators. Stephanie, there are more people who want to get a vaccine and haven't yet than there are who are concerned and don't want to get a vaccine. So we need to continue to increase access. At the same time, we need to get the best messages and messengers to the right communities. Vaccinate or mask, that's a great message for a lot of people. There are going to be other messages that are important as well, including really highlighting the stories of people with long COVID who are still struggling and suffering from COVID infection. And these can be healthy young people who are now having difficulty going about their daily lives. I think showing the reality of COVID will also help, especially as there are fewer and fewer cases, so people may have a kind of less of a sense of urgency to get vaccinated.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.